Assalamu alaikum dear students. Today we will discuss midwifery and gynecology MCQs part first. The normal duration of the third stage of labor is option A 5 minutes, B 30 minutes, C 10 to 15 minutes. So the correct option is B 30 minutes. The fetal heart rate can first be detected using Doppler ultrasound at option A 4 weeks, B 6 weeks, C 10 to 12 weeks, option D 20 weeks. Correct option is C 10 to 12 weeks. Subscribe now and press the bell icon. Never miss an update from early technologist. The main purpose of colposcopy is to option A view ovaries, B visualize endometrial lining, C examine cervix under magnification, D detect fallopian tube patency. So the correct option is C examine the cervix under magnification. The first sign of puberty in girls is option A menarche, B pubic hair growth, C breast budding, D growth spurt. So the correct option is C breast budding. The most common cause of primary amenorrhea is option A PCOS, C B Turner syndrome, C androgen insensitivity. Correct option is B Turner syndrome. Which vitamin is most associated with preventing neural tube defect? Option A vitamin A, B vitamin D, C vitamin B12, option D folic acid. So the correct option is D folic acid. Normal fetal heart rate is option A 80 to 120 beats per minute, option B 120 to 160 bpm, C 60 to 100 bpm, option D 100 to 120 beats per minute. So the correct option is B 120 to 160 beats per minute. Preeclampsia is diagnosed with option A proteinuria and edema, option B hypertension and proteinuria, option C hypertension and seizure, and option D edema and headache. So the correct option is B hypertension and proteinuria. During pregnancy, cardiac output increases by approximately option A 10%, option B 25%, C 30 to 50%, and option D 70%. So the correct option is C 30 to 50%. The most common sexual transmitted infection is option A HIV, B syphilis, C chlamydia, and option D gonorrhea. So the correct option is C chlamydia. The gold standard test for diagnosing endometriosis is option A ultrasound, B CT scan, C MRI, option D laparoscopy. So the correct option is D laparoscopy. The most common symptom of uterine fibroids is option A amenorrhea, B menorrhea, C vaginal discharge, D infertility. Correct option is B menorrhea. The most common type of vaginal cancer is option A, adenocarcinoma, B, sarcoma, C, squamous cell carcinoma, option D, melanoma. Correct option is C, squamous cell carcinoma. In which phase of the endometrium thickest? Option A, menstrual phase, B, proliferative phase, C, secretory phase, option D, ovulation. Correct option is C, secretory phase. Ovulatory cycles are most common at option A, menarche and menopause, B, pregnancy, C, mid reproductive age, option D, lactation. So the correct option is A, menarche and menopause. Pap smear is used to detect option A, vaginitis, B, endometrial cancer, C, cervical cancer, and option D, ovarian cyst. So the correct option is C, cervical cancer. Thank you for watching my videos.